So here I'm going to talk about communicable diseases. First one is HIV and AIDS. HIV, this is the virus. HIV stands for human immunodeficiency virus. And HIV causes the disease. It is called AIDS. AIDS stand for acquired immunodeficiency syndrome. And HIV is a retrovirus that target CD4 lymphocyte. CD4 lymphocyte is a T cell and resulting in decrease the immune function and susceptibility to the infection. And is characterized by generalized dysfunction of immune system. The diagnosis of HIV associated with certain illness or condition. And HIV infects CD4 cell and gradually decrease CD4 T cell count, and that result in progressive immunodeficiency. The risk for opportunistic infection is present. And HIV transmission occurs through the blood, semen, vaginal secretion, and breast milk, or incubation period is month to years. Horizontal transmission occurs through the intimate sexual contact or parental exposure to the blood or body fluid contain the HIV. So what are the risk factors? So risk factor means transmission from infected mother to the baby, because we are going to focus pediatric section today. Or if you have any physical contact, sexual intercourse with infected person without any barrier method like condom. Or I said, from mother to infant, it is possible to transmit perinatally or via breast milk, blood product, or unprotected sex, IV drug use. Here a flow chart showing immune system, categorized specific, non-specific. Non-specific means monocyte, macrophage, neutrophil. So they are motile, they like to fight with bacteria, and they is defends our body because phagocytosis properties. And on the other hand, specific, cell-mediated and humoral. Humoral one, complement system or B lymphocyte. B lymphocyte can produce antibody in presence of antigen. There are 5 types of antibodies: immunoglobulin A, immunoglobulin D, immunoglobulin E, immunoglobulin G, and immunoglobulin M. Easy way to remember: deemed G, A, M, E, D. Cell-mediated by T lymphocyte, and type of T lymphocyte: T helper, T suppressor, T cytotoxic, and lymphokines. And here, About some description, vertical transmission occurs when an HIV infection pregnant women to her fetus. The most common opportunistic infection that occur in children infected with HIV is a pneumocystis pneumonia. And pneumocystis pneumonia most frequently occur between the age 3 to 6 months. And pyramid alert means an infant or child infected with HIV is at the risk for developing a life-threatening opportunistic infection. Monitor the infant or child closely for sign of infection and report this sign immediately if they occur. Here showing the community-acquired immunodeficiency syndrome, like Candida esophagitis or cryptosporidiosis, cytomegalovirus disease, herpes simplex, human immunodeficiency virus encephalopathy, lymphoid interstitial pneumonitis, mycobacteria infection, pneumocystis, pulmonary candidiasis, or recurrent bacterial infection. So it is an opportunistic infection. When body is immunocompromised, your body is easily get attacked or infected. Also, patient present with chronic cough, chronic recurrent diarrhea, developmental delay, in case of pediatrics, phyllothritis, hepatosplenomegaly, liver enlarged, spleen enlarged, lymphadenopathy, malaise, night sweat, oral candidiasis, and weight loss. The patient who have HIV as a mild condition, usually they present with lymphadenopathy, very mild, or hepatomegaly or splenomegaly, recurrent respiratory infection, or dermatitis or parotitis. If a patient severe stage, most of the times they present with multiple serious bacterial infection like sepsis, meningitis, pneumonia, or Kaposi sarcoma, wasting syndrome, tuberculosis is more common, or esophageal or pulmonary candidiasis developed. So it is good to follow some precursor. It is better to follow the standard precursor. Here we're going to talk about how to take care of the patient who had HIV. But let me talk about how we diagnose HIV. Diagnostic test. Before testing, counseling should be provided to the parents. An issue that should be addressed include the cause of HIV, reason for testing, or implication of positive test result, confidentiality issues, and beneficial effect of early intervention. So if anybody suspected, it is good to go for testing. Because if you diagnose the disease at the very beginning level, you can stop to the progress or disease system will be delayed. HIV infection basically 3 stages. We call stage 1, stage 2, and stage 3. And stage depends upon number of CD cell. So what are the different tests? Enzyme-linked immunosorbent assay, we call it ELISA test, Western blot, polymerase chain reaction, or CD4 lymphocyte count or T lymphocyte count. ELISA test responsible for antibody to HIV, Western blot presents HIV antibody, polymerase chain reaction, presence of proviral DNA, and CD4 lymphocyte means immune system status related to specifically suppression. So if CD4 count less than 1,500, we call stage 1. If CD cell below 1,000 or 700 to 1,000, we called stage 2. And stage 3, when CD cells count less than 750 or less than 500. So, into professional healthcare approach is taken, and primary goal are disaccelerate the replication of virus and prevent opportunistic infection. Also provide nutritional support, give the treatment, and treat the opportunistic infection. So it is the importance early diagnosis of the disease. So now, little bit prophylaxis from opportunistic infection. Provide the prophylaxis are prescribed again pneumonia or other opportunistic infection, particularly during the first year of life of infant born to HIV-infected mother. And after 1 year of age, need for prophylaxis to determined on the basis of presence and severity of immunosuppression. Also continue the prophylaxis based on child's HIV status. And HIV status, we can find out counting CD4 cell. So here, treatment. So care of the child with HIV infection or AIDS. It is called antiretroviral medication because HIV is a retrovirus. So you give them antiviral or antiretroviral medication. So first of all, before an antiretroviral medication is administered, that medication is checked to be sure it is safe for pediatrics patient. Also, contraindication for use and advice, the effect are checked before administration. The goal of antiretroviral medication is to suppress the viral replication to slow, right? So if you stop the replication, it is good for the patient and reduce the incidence and severity of opportunistic infection, or we can delay the disease process. Medication affect different stages of HIV life cycle, prevent the reproduction of new virus particles. And combination therapy may be prescribed and include the use of more than one antiviral medication. So what else? What about the immunization? If the pediatrics patient or children diagnosed with HIV, immunization against the childhood disease is recommended for all child exposed to and infected with HIV. If a child has a symptomatic HIV infection or has a severe immunosuppression, we follow the guidelines like only the inactivated influenza vaccine that is given intramuscularly should be used. So influenza vaccine should be given yearly, but measles vaccine should not be given. Or only inactivated polio vaccine prevent the poliomyelitis that is given intramuscularly, but rotavirus vaccine should not be given. Rotavirus can cause very bad diarrhea. Or give them varicella zoster for chickenpox should not be given. Varicella zoster immunoglobulin may be prescribed after chickenpox exposure. Also, tetanus immunoglobulin may be prescribed for tetanus prone wound. What else? So what are the nursing care? So always wash the hand frequently. So standard precursor is important. Monitor the child for infection like fever, malaise, fatigue, weight loss, vomiting, diarrhea, right? Or notify the primary healthcare provider if any of this occur. So if patient have a vomiting and diarrhea, you have to prevent the dehydration. If patient has a fever, we have to prevent the infection. Infection is the first priorities. Monitor the child for signs, symptoms of opportunistic infection, such as pneumonia. Antiretroviral medication or other medication are administered to the child. The child needs to be restricted from having contact with persons who have infection or other contagious or potentially contagious illness. And keep the child's immunization up to date. And avoid direct unprotected contact with the child body fluid. Monitor child body weight. And we provide the diet high in calorie, high in protein, right? Also admin total parental nutrition is ordered. We prevent the infection. It is the first priority. Hand washing important. Avoid the sick individual to meet with the patient. Also admin medication like antiviral medication. Do not share the eating materials. Wash all eating stuffs or cover any of the child unused food, and do not allow the child to eat fresh fruits or vegetables or raw meal or fish or meat because they are the source of infection and our baby has a immunocompromised. Also wear the gloves when carrying the child. Change the child diaper frequently. Fold the child soiled disposable diaper inward. or disposed to the trash daily, and clean up any of the child body fluid spell with a bleach um, with a solution, and there should be 10:1 ratio. So what are the education of the patient? High risk behavior and also importance to avoid high risk behavior. Method of transmission of HIV, it is important to know how it is transmitted, and also we have to find out the risk factors like transmission from infected person to others, importance of sex education or sexual contact such as intercourse, and importance of using safety barrier like condom if intercourse is planned. Also, resources available for support of the other issues.